Doctor, we are live now.
Okay. Warm welcome and a very good evening to every one of you. This is the online Glaucoma Society of India's online session webinar, and today we have a very interesting session. I am Dr. Satyan, President Glaucoma Society of India. Today we have just changed from our clinical talks. We have changed to management talks because it is going to be very important session because it is just not enough when we have only the clinical stuff. So we need to understand how we can do proper practice as well, so that we can be useful to the society, and we too have to be benefited from various ways. So with this a very small introduction, I'm going to introduce today's eminent speakers. We have Dr. Sendil. It is not that he is unknown to people. He is one of the most interesting personalities, especially when it comes to the management courses. Dr. Sendil himself is an ophthalmologist, but unfortunately, he is not practicing as a clinician, but he kind of teaches every one of us how to do a proper management of our hospitals. So he is the founder of Ofthal. I think many of us are well aware of this. It's kind of a manufacturing center, as well as he does sales online, and we have all seen in many of the conferences they have the stall. So they do the manufacturing of microscopes, slit lamps and instruments, etc. Not only that, Dr. Sendil has got lot of talent, and also he takes personal interest in many of us to train us in the practice sessions, management sessions. So I am one of the beneficiaries from Dr. Sendil. He has been training for quite some time now. So he has trained more than 250 ophthalmologists in personally, and he keeps on training many more people. So Sendil said, "Sir, just don't introduce me too much." He said, "This is just tell us about this Avtal, so that is more than enough for me." But Sendil, I know very well about you, how much you have been helpful to all our ophthalmologists in our practice management. And we have Dr. John Shaker and also Mr. Rajarajan. So both of us are going to be talking to us. Both of them are going to talk to us. I'm going to request Dr. Sendil to introduce them when they start their sessions. First, I'm going to request Dr. Sendil to talk on the psychology of the patient. Over to you, Dr. Sendil. And first of all, a sincere thanks to each one of you for accepting our invitation to be part of our online webinar. Over to you, Dr. Sendil.
Yeah, thank you, Dr. Satyan, for the kind introduction. And it's always a pleasure to talk to Dr. Satyan and see how he has developed over the last many years. And good friend, I think more than colleagues, we are also good friends, and we have shared a lot of insights together. And thanks to Glaucoma Society of India for this nice opportunity also. And today, what we thought was, let us, rather than having the regular webinars, regular clinical webinars, which you have a lot of people talking about it, we thought let us introduce to you some very interesting concepts which might also be helpful in your day-to-day practice. And basically, we have also tried to customize it for glaucoma, because I'm sure many of you who are attending these sessions are glaucoma physicians and glaucoma surgeons, basically. And I am going to talk about a different aspect of practice management, and in terms of counseling also, because generally counseling, we always think that, okay, it's about some counselor who talks about the cost of the surgeries, or somebody who will explain the different types of lenses. But counseling also has a lot of psychology. So, is my screen visible, sir? Like, yeah.
Yes.
Okay. So everything is
Sendil, we can see you, but not your slides.
Okay, 1 minute, sir. I'll just try.
It was visible.
Okay, okay. I think now it should be visible. Yeah. Is it visible now?
Yes, yes. Now we can see.
So counseling is not only talking about the cost of a procedure or trying to convince a patient for a procedure, but there is also a lot of psychology involved in counseling. So we will be talking over the next 10-15 minutes about what are all the different psychological aspects of a patient counseling, and a slightly a different perspective of what we generally talk about, because see, everything is psychology. Because I'm sure many of you have read this book, Psychology of Money. Basically, even earning money, saving money, there is a psychology involved in that. And in terms of counseling and converting a patient for a procedure, also, there is a lot of psychology involved. And let us understand over the next 10-15 minutes what are all the different psychological principles which are available, which we can also use in our day-to-day counselor, and also we can use that to train our counselors also for that. So let me start with a small story. I'm sure many of you know Winston Churchill. So when he was the prime minister, there was a meeting or a dinner of Commonwealth presidents and prime ministers, which was happening in an evening. And then during the dinner, one of the employees of Winston Churchill it was hosted by Winston Churchill, and one of the employees came to him and said that, sir, one of the salt shakers has been missing. But it's not a basic salt shaker. It's basically a very expensive one from the Georgian era, and maybe it is worth the thousands of pounds. And then you cannot afford to miss that salt shaker. But on the other hand, because all the dignitaries are also all the dignitaries are prime ministers and president, you cannot go and check them also. So what Mr. Winston Churchill did was, he took the identical pepper shaker and he hid it under in his coat pocket, and then he knew that this was the person who would have stolen the shaker, and that person was standing near the window, and then he just went closely to her and said, like, I think we have been caught, and I have got the pepper shaker. Let us go, and you have got the salt shaker. Let us go and replace it in the original place. So basically, what he is doing is, he is trying to handle the psychology of the other person. Because if you say, I have also stolen this thing, then he will go and keep the shaker back. So that is the psychological principle which Mr. Winston Churchill has applied. So a lot of things in life also work based on psychology. And let's see how we can also use similar psychology in counseling. So basically, human beings are tuned for logical solutions. What is logical? For example, this takes 10 minutes to go, or there are many, everything we kind of calculate with the logistics, logical. Basically, in terms of revenue, we are always used to calculating things in a metric. But human beings are more also tuned to psychological solution. For example, in a hospital, if patient is waiting for a long time, patient is not actually worried about the waiting time. Patient is more worried about the uncertainty. Because if you, let's say you go to a bank, the bank will give you a token number. It's saying the next token will come in 10 minutes. So they are very sure that within the next 10 minutes, patient can be, you will be called. But in a hospital, patient is worried because doesn't know whether he has to wait for 10 minutes, 30 minutes, or 1 hour. So that is the biggest reason why that problem of waiting and people coming and fighting happens. So for example, let's see what the companies like Uber and Ola do. Basically, they tell you that, okay, the car is now in this point, it will take another 20 minutes to reach or 10 minutes to reach. So even if it takes a longer time, you are okay to wait because there is no uncertainty. So avoiding this uncertainty is a psychological concept. So in a hospital, if you have a queue management system, that will avoid the uncertainty. Basically, I'm bringing you this example to show you the importance of psychological. How do you think psychological solutions are more important than logical solutions? So offering just a pricing to the patient is a logical solution. This lens is 10,000, this glaucoma procedure is 20,000, but also you should appeal to the psychological aspect of the patient. That is what we are going to learn over the next 5-10 minutes in this presentation. So there is a concept called as reverse benchmarking. So if you want to improve your practice, so basically how do you actually improve? So what is benchmarking? Benchmarking is we always take the gold standard. For example, applanation is the gold standard of intraocular pressure measurement. So, or like say one hospital, they have done this best thing, so they are benchmarked. So we want to do things similar to a bigger hospital or a similar to a larger organization. But reverse benchmarking is you also understand what they are not doing properly and try to focus on that. For example, let's say corporate eye hospital, they do so many things in a very good way, like customer service, all those things are very good. But maybe there is no customized experience. For example, if you go to Dr. Satyan's hospital, so he gives you a customized experience. He sees you. Maybe before surgery is the same doctor, after surgery is the same doctor. So you try to reverse benchmark. So basically, even in your counseling, you need to understand why the patient is coming to you rather than going to a corporate hospital or a charitable hospital, and what are the things they are not doing properly, and try to benchmark against that. So rather than trying to not do a benchmarking in the straight way, try to do a reverse benchmark. That is also something important in psychological aspects of counseling. And understanding the difference between sympathy and empathy is also very important. Basically, because see, I'm sure many of you know what is sympathy, or many of you also might know what is empathy. For example, these two products came from the same company, Tata. For example, the Tata Nano, the Tata Ace, which is the load pickup vehicle. So Tata Nano was born out of sympathy because Ratan Tata saw that when he was traveling in a car, and he saw this family of four traveling in a motorbike, and then they were drenched in the rain. So he immediately thought, okay, why not I give a low cost car to these people? And then he created the Tata Nano. But this product was born out of sympathy. But on the other hand, the Tata Nano, I'm sure all of you know that it is a failure. I'll tell you why it was a failure. So the Tata Ace was born out of empathy because the people who made this Tata Ace vehicle basically understood the problem of the person who was driving this load vehicle, or maybe a tricycle person, or the difficulty in paying for a bigger vehicle when your load is very small. So the Tata Ace was born out of empathy. So sympathy is feeling sorry for a person, but empathy is getting into the shoes of the person and working for him. So Tata Nano failed because it was born out of sympathy. Tata Ace succeeded because it was born out of empathy. So as a doctor or as a counselor, you need to have an empathetic approach to the patient. So if you empathize with the patient, then the solution or your counseling will also work better. So then there is this concept of social proof. So basically, people also want to go to a hospital where there are lots of patients. So, or where there is already a lot of crowd there, lot of surgeries, a doctor who has already done many surgeries. We don't want to go to a hospital which is less crowded, or where there is no crowd, or when there is not too many patients who have been operated by the doctor before. I'm sure all of you know about this Iruttakadai in Tirunelveli, where people go to the shop which is just open a few hours in a day, and then there is not even a board there, but people go there because there is a social proof that the shop is good. So human beings don't want to do a lot of work, don't want to do a lot of research. So they just want to follow another person. So you should also understand how you can create social proof. Your counselor should also be focused on creating the social proof in terms of patient testimonial. Maybe if you have a celebrity who got operated, displaying that success stories of patients. And then nowadays with Instagram and other social media tools, there is so much of ways to create that social proof. In Coimbatore, I am sure there was a diabetes center. That doctor unfortunately passed away. So he used to create the social proof in a very good way. Basically, what he will do is he will there was a huge wall in his hospital where he'll say these are the 20 people who conquered diabetes this month. Whoever got blood sugar under control, he will put all their photos. It was like a wall of fame. So that social proof creating and taking that social proof to the patient is also a very important role of your counselor. So, and make sure you have a book or a testimonial book which is shown to the patients. Or if the doctor has also won awards, create that social proof. The counselor should also be talking about all those things to appeal to the psychology of the patient. And then authority. So basically, people also want to go to a person who is authority in a particular aspect. For example, let's take example of Dr. Satyan also. So Dr. Satyan has worked in large hospitals, and then he is an authority of glaucoma. Maybe he has won so many awards, being the president of Glaucoma Society of India. All these things are something which will showcase your authority, and people want to get treated by authorities. So you also have to create ways so by that you mean that you are an authority in that particular subject. So maybe displaying your awards, or if you are given going to a foreign country to present a paper, or your Instagram profiles, your Facebook, all these things should display that you are an authority on that particular subject, and then people want to go to the authority. So using the authority and your counselor also displaying that my doctor is an authority in this particular subject is also important to convert the patient or convince the patient. So other main thing is this is a principle called choice architecture. For example, I've seen many hospitals where they say like, oh, we have 30 different kinds of packages for cataract, or there are 10 different packages for glaucoma, different types of implants for glaucoma. Basically, if you give too many choices, the patient gets confused. Make sure your counselor doesn't give more than say 5 to 6 choices for every procedure. Cataract, you should only have 5 or 6 choices. Glaucoma, maybe you have only 2, 3 choices, and let the patient select from the choice within that. Because if you confuse the patient with many choices, patient is going to not understand what he wants to select, because there is a lot of difficulties or disadvantages in giving too many choices to the patient. And don't brand using the implant of glaucoma, brand using the procedure. For example, cataract surgery, you don't say that this company's lenses, or what. Don't brand your surgery with the lenses, but always have simple packages. For example, regular monofocal or premium monofocal, and then premium multifocal, regular multifocal. Just 5, 6 choices, which is easily understandable by the patient, and then makes the selection process of the procedure easy for the patient. So if you have a package which is having too many choices, if you have a package which is kind of confusing to the patient, it is not going to work out in your favor. Because many of the times you also see that patient always says, sir, you put what is best for me, or you whatever you suggest I will take. So then if you have less choices, it always makes it easier for you to select or offer it to the patient. Something which I want all of us, all the surgeons, because I've seen many hospitals which has got too many choices and too many confusion, because the companies give you those lenses and then you want to add all the lenses in the packages, then it becomes too much of a confusion to the patient. One important thing which I want all of you to carry from this presentation is this concept of choice architecture. Even if you're not understood the other concepts, if you have too many confusing packages, please reduce it to as low as possible. And if you want support from me into designing your packages, please do feel free to contact me for the same. And then you can also follow something like decoy pricing. Basically, this is another concept used by majority of the companies. For example, if you have a standard package, I'm not able to ask you a question. If you can think what is the package which the seller wants to promote. There is a $0, there is $11, there is an $18, there is a $320. So you need to understand why there is a difference between 18 and 320. So, and which package which the seller wants to promote. So think this as a cataract surgery or a glaucoma surgery. So if you want to promote a glaucoma procedure or cataract procedure for 40,000 rupees, so let's say there is a very low cost, 10, 20, 40, and then the premium should be say 1,20,000. So, and the difference between the premium and the standard should not be too many differences. So for example, patient should be thinking or understanding that, okay, even a standard package, I'm not getting too much by paying 1,20,000. So I can get something similar or a little bit lower one for 60,000 rupees. Then the patient will go to the standard package. So the pricing of your procedure, the pricing also is very, very important. How do you display that pricing to the patient also makes a lot of difference in the value of the procedures which you are offering to the patients. And another thing is having a transparent pricing is also very important. Basically, it's like you can even have like a menu card or explain the procedure, printed card where all the prices are transparently available. Because I've seen many hospitals which is writing and showing the procedure cost to the patient. Then patient might think that, okay, this is something not a standard one. Can I ask a discount? But if it's already printed format, people understand that, okay, this is something very standard and maybe they may not be able to offer too much of a discount. Another thing I want to drive is many times doctors advise and sometimes many doctors also try to tell the prices for the procedures. One thing I want to drive through today is there should always be another person because the doctor should not be talking about the prices directly to the patient. Always try to pricing discussion should happen with the counselor. Reason is, one thing is if the doctor is telling the pricing, then patient will immediately ask you for a discount. Second thing is patient might also think that the doctor is too commercial. Third thing is, as a doctor, you are very desperate not to lose that patient. Your psychology is, okay, I know, okay, my surgery, I'm telling 60,000 rupees, but I can still afford to do it 30,000 rupees. But you are desperate not to miss the patient. But a counselor, on the other hand, is basically somebody who will tell what you know, what you are going to tell him to talk to the patient. Second thing is, he always doesn't know the real value of the procedure or the implant involved in that procedure, mostly. Then he will talk and he may not give a bigger discount. Patient is also free to discuss all these things with the counselor. So the pricing always should not be handled by the doctor. Pricing should not be mentioned by the doctor to the patient. You suggest the procedure, then you say, okay, you go to the counselor. The counselor will talk about different packages, he will explain you in detail. Let the counselor talk about the pricing. And if you want to have an average surgical cost of say 40,000 rupees, always have a standard and premium, and then the standard is 40,000, the premium should be 80,000, 90,000, or 1 lakh. So the margin is very different. So then let the patient who has the money can go for premium, but majority of the patients will go for the standard pricing. So applying this business principle also appeals to the psychology of the patient. So another important thing is reframing. So how does the way we explain things, the way we talk to the patient, or the way the counselor talks to the patient makes a huge amount of change. So for example, if you want to say, okay, most patients want to reduce spectacle dependence, this is a better way rather than telling monofocal lead of toric lens, which is what is your choice, because patient may not understand this. So, and something which the patient easily understands is what your counselor should be talking. And then reframing pricing with the value. For example, this lens is costing 45,000 rupees more. Or if you put this lens, it will reduce your dependence on wearing glasses for mobile phone, or it will reduce your dependence, or it will give you good driving, all those things. So always convey the value first, the pricing last, rather than telling that pricing first, because that will also deter the customer or the patient. So the way we talk and the way we explain the procedure to the patient also makes a lot of difference. And reframing is a very important psychological concept, which we have to teach our counselors how the counselor talks, because patient is observing each and every word of the counselor. And I will also suggest that many of the times it is always better to have a camera or a video recording in your counselor's room. So you can always use that to train the counselor the way they are talking. And how they reframe, how they talk, I think it's the role of the doctor to teach the counselor what they should be talking, how they should be talking. So don't talk too many technical jargons. Talk in a simple way the patient can understand, and always reframe pricing with the value. So there are also, in psychology, there are also small things which are very, very big. For example, even today I read one article and saw a video where Dr. H.V. Hande, a very senior politician, whoever goes to him, I think this present Speaker of the Assembly went and met him. Dr. Hande always gives a written appreciation to everybody. So people value a written letter rather than something which you print and send. So even small things which we do are psychologically taken very big by the patient. For example, if you give, there is a temple inside the hospital, or if the counselor gives a vibhuti to the patient on the day of surgery, or you doctor giving a handwritten note, or the doctor calling the patient personally on the day of the surgery or after the day of the surgery and talking to him about all these small things which you do. You can decide what are all the small things, but small things create a big impact. So psychologically, whatever, these are the things which will drive you more patients, get you more word of mouth referrals also. So think what are all the small things. For even when I go to my order food from my restaurant, the chef handwrites and then say, "Thank you for ordering this food. I hope you enjoy." He literally writes and sends it, which makes a lot of value. So all those things, I think you should also understand that small things are always big. I think last few slides, basically the concept of loss aversion. Human beings are always wanting to avoid a loss rather than gain. So you tell what will be the loss. For example, this lens will reduce the need for your glasses. That is a gain framing. But if you say with a standard lens, you will need glasses for reading and another mobile use, then patient wants to avoid that loss. So talk promoting for even glaucoma. If you don't get this surgery, you might lose your vision. Or if you want to say that, okay, if you do this surgery, we can preserve your existing vision. But always human beings want to avoid loss. So try to frame the loss. We are not telling you to threaten the patient here, but if you want to convince him to apply medicines. For example, I'm sure many of you are glaucoma physicians and surgeons here. So basically, if you say, okay, you have to apply the medicine, then we'll preserve your vision. But if you also say, if you don't apply the medicine, you will lose your vision, that will make them more compliant. So always try to use the loss aversion strategy also when you're trying to convince patients, either for procedures, medications, and all. So yeah, I think so. Yeah, this is my end of my presentation, and I would be happy to take one or two questions before we ask Mr. John Shaker sir to talk.
Thank you, Dr. Sanil. Wonderful. It is a lot of things are probably we are kind of practicing, but how do we really refine in our own words makes a lot of difference. So, in glaucoma, it becomes even more critical because the patients are not having much of a problem, especially when we say that you have glaucoma, but the patients may not be really aware of. So, acceptance and the compliance issues are really high in glaucoma. So, even advising them for surgery when they really don't have a problem, it becomes really a messy thing. Though we know that he will require either a laser or a surgery, but the patient usually they don't really accept. So this is a challenging situation in glaucoma than in cataract surgeries because the visual quality is poor. So he immediately accepts. So how do we really kind of manage this kind of situation? What do you really advise?
So basically,
Acceptance and compliance becomes a challenging situation in glaucoma.
yeah, I think, see, the problem in glaucoma, retina, or a specialty practice is you're not able to, it's not as straightforward as a cataract surgery. Because cataract, if you do, patient is able to see immediately. But glaucoma, many times, patient still feels that, okay, my vision is right. Why is the doctor advising me surgery? Or why is he advising me lifelong medication? Only as way we have to do is, I think, creating awareness. Patient has to be educated. Many times, patient education is not as we imagine in India. Because I remember when I went to US around 10-15 years back, my friend had LASIK surgery. So he showed me like the doctor has given him so many. First thing is, if you go to LASIK, they don't immediately do LASIK there. They give you a lot of material to go back home. He had so many printed materials about LASIK. He had to go read it for 1 week, then he goes to the surgeon again. So basically, get the knowledge, and then the first thing the surgeon says is LASIK is not going to, I am not guaranteeing a 100% glasses removal. So
Right.
all those things are done. So glaucoma also, I think, is a disease of where there is so much of education needed for the patient. I think
Absolutely.
counselor can actually play a role, and then slowly tune up the patient to that. Because even see, we as doctors are very bad patients. How many of us take our medications properly? For
Right.
example,
True, true.
cholesterol or sugar medicines. So basically, I think comes boils down to education. That is the
Yeah,
only thing.
so very interesting thing has happened today for me in OP. So one of my patient who has been coming to me for the past almost 25 years. So very interesting actually.
Mm,
He told me I didn't know that I have to press the bottle
mm,
to apply the medicine. And he's been on medication for the past 25 years.
mm, mm,
It's quite interesting because he always felt he has to just shake the bottle and then
mm,
somehow he has shaken the bottle to apply the drops all these years.
mm,
So
mm,
it's quite interesting. He said nobody has told me that I have to press the bottle to apply the
mm.
medicine. That was a big surprise for me. He's
Many patients who undergo glaucoma surgery also sometimes think it's cataract surgery. They ask, sir, have you implanted lens inside? So they different though, even this happens even in educated patients, not only people who are not educated or rural patients, even educated patients have these questions. So I think awareness creation, we have to optimally educate the patient. Too much of awareness or education also sometimes become works in a reverse way. So optimally educating the patient.
So I think the statement which you made, like that loss aversion, is one of the main things that probably one has to look into when you are doing the glaucoma counseling to an extent.
Yeah,
So
because
that the
many
people,
times what I see is we say, oh, this medicines will preserve your existing vision.
right?
But that may not ring the tone for the patient. If you say, if you don't apply medicine, whatever remaining will also get. Though it's a negative thing, I understand it's, you don't have to be so negative, but still, though, that works 80% better than saying the other. Just a simple reframing of the question will definitely help. Sometimes we have to give a bitter medicine to the
Right,
patient also.
right. You got it. So thank you, Sandil, because we can keep talking about this. We'll move on to the next presentation.
Yeah. So,
May I request Dr. Sandil to introduce who is going to be the next one, Dr.
yeah. No,
Rajarajan
Mr.
or
John
Mr.
Shaker.
Rajarajan or
Mr. John Shaker.
John
okay,
Shaker, sir.
okay, please.
Yeah. So I take great honor and privilege in welcoming Mr. John Shaker, very senior healthcare professional, well respected in the industry, and in fact, he is a part of our Aftal also. He is a part of our Aftal program, where he handles the human resource management sessions. In fact, we are also working on a HR for eye hospitals module. We are in fact launching a HR academy also with Mr. John Shekhar, because he's almost like an university. He is an academy himself, so much of experience in HR and strategy. So there is a lot of question being asked, sir, how do I plan an incentive system? What kind of incentive should I give to my staff? This question kept on coming repeatedly. Then I asked John Shekhar sir to give a presentation on this based on his experience in many hospitals. And John Shekhar sir is a HR people management officer and a strategy person. Presently, he is with Bewell Hospital, Chennai. And over to you, sir. Sir, you have to unmute. You have to unmute yourself. I think you are muted, sir.
And now screen is visible?
Yes, sir.
Yes, sir. Sir, we
Every
can see
Okay.
the screen. We can hear you well now.
Yeah, fine.
So,
So,
sincere thanks and appreciations to you for kindly, accepting our invitation. Over to you, sir.
thank you very much. Uh, um, One fundamental question, what normally people will ask, there are two kind of mindset. One is employee mindset, another one is an employer mindset. Employer normally will tell, I'm paying the salary. Why should I do something extra for my employee? Employee will also have the similar mindset. Yes, for the salary, I'm doing something. So why you are expecting me to do something more? These are all the two interesting phenomena that is happening in almost all the industry. So that is the one thing that what I have learned in the last 40 years of my tenure with various industries. I worked with manufacturing, I worked with retail, I worked with healthcare, I worked with even very, even a saloon industry also. So I worked with the saloon industry. Um, the one interesting thing before talking about the incentive plan, uh, why the incentive plans are much important for people to accept and people have to work it out. The year 2000, I was the first HR person for a saloon industry. Today, you may be seeing the green trends. I was working with Kavinka. I was working with their manufacturing division and I was working with their food division. When they started the saloon division, they promoted me, then they sent me to the saloon division. That time, the minimum salary for a hairdresser or a beautician was 2,500 rupees. That was the minimum wage that time. 2,400 rupees was the minimum wage. The people used to get, that is the first time the corporate type of saloons are emerging. That is the first saloon. Lakme was there. After that, this was the only saloon, a family saloon. Uh, then we created a incentive plan for the industry, saloon industry. Because when we think of saloon, only hair cutting for gents. For female, it's only the threading or small, the makeup kind of things, facial kind of things will happen. But when I entered into that field, then I found a lot of menu cards are available. A lot of services are available, even for hair cutting, scalp massage, hair coloring, and even for female pedicure, manicure. A lot of things were available that time. I'm talking about 2000. How to promote all the things? How we have to take everything to the uh, customers? That was the challenge. When we are hiring a person for doing a haircutting, that time haircutters were called only barbers. So no other nomenclature were there. So these people normally used to cut hair, normally used to, even though hair washing was not happening, only used to cut hair. Coloring was not there. Very few people used to do coloring. Used to do shaving. For women, only eye threatening were happening. Here and there, small facials were happening. That time, in order to promote the service, what are all the services that we are offering to the to the customers, and what are the things that we want to do it for the customers, then we introduced a incentive scheme. The first incentive scheme, it started slowly picking up. A day has come, then people started more than salary, they started earning incentives. Salary was 2,500 rupees. Incentive people used to get 4,000. I know there was a girl in Annanagar. Her salary was 2,400 rupees. You used to get incentive for 7,000 rupees in 2000 years. The why? Because she used to talk to the customers in such a way, what are all the skills she knows, she started promoting the thing. That is the reason. So there are two kind of reasons, for getting salary, I will do certain activities. If there is an opportunity for earning more, so a lot of things will automatically it will happen. With that perspective, on this I am going to talk about today the incentive plans for hospital industry. I have a lot of experience in devising incentive plans for hospital industry. I was the first person in 2012. I developed incentive plan for Kaveri Hospital. Even till today, the same methodology people are using it. Then wherever I worked, I created the incentive plan for different type category of people. Okay. So now I am coming to the core topic. Okay. First of all, we need to understand, so what is incentive? When we are talking about incentive, it is not only a monetary kind of incentive. There is a lot of non-financial rewards are also. So there are two things. When we are talking about incentives, one is a financial or non-financial rewards linked to clear, measurable performance target, aligning staffs and doctors behave with the strategic goals. That is very, very important now. Then whenever we are talking about incentive for healthcare, then immediately people will talk whether it is for healthcare incentives are ethical or unethical. Okay, ethical sense are, yes, we need to have very clear, measurable performance targets. Yes, somebody is exceeding the target, that person has to be rewarded. When we are rewarding that thing, lot of good things are happening to the patients. So recently, what I am thinking in my mind, okay, the incentive plan, it should be linked to the patient's experience or patient satisfaction or even for the patient safety also. So that is the one thing. So the incentives can be formalized for three different categories. One is for the individuals, for doctors, counselors, coordinators, sales staffs, the incentives can be paid. Even there are certain areas, a team incentives, our business development or OPD or surgery or optical teams, these are all a team incentive. Another one is the organization-wide incentive. So when the overall hospital targets were met, then certain things can be given to them. This is a broader thing. So when we are planning to give incentive, it should be a clear, measurable a performance target. So people have to align themselves to achieve the target. The incentives can be paid for the individuals or the team or for the organization wide. So today I'm going to give you one more perspective. Uh, when we are talking about incentive, there are three important words also you need to understand: incentives, bonus, commissions, allowances in HR management. All are not the same. Incentive and bonus are not the same. Incentive and commissions are not the same. Incentives and allowances are not same. Bonus and allowances are not same. So everything has a different meaning. So today, let us understand how this entire concept is working for the industry. So now, what is an incentive? A small definition of incentive: extra payment given for achieving a specific performance target. Whenever you give a target, a specific target, the person is achieving the target, yes, then incentive has to, that is called incentive. Something is given, if somebody is exceeding that thing or achieving that thing, so something has to be paid. That extra thing is called incentive. So what is the purpose for creating this incentive? To improve productivity and enhance the performance level of the individual. That is the thing. So when it is paid, after achieving the target are key performance indicators. So whether it is linked to the individual and team performance, whether it is a fixed or variable, it's a variable. So what is a typical implication in the organization? Encourages employees to achieve measurable goals and improve results. So, okay. Suppose if our hospitals, they want to set a target, they want to set a goal, and they are hospitals and expecting all our employees to exceed whatever the target, whatever the goals they have fixed, then they need to introduce the incentive scheme, because incentive is not a salary, it's extra payment giving to an employee for achieving a performance targets. It improves a productivity and even a performance. That is called incentive. So examples of incentive, okay, lot of conversion, IP conversion incentive. Suppose our office, we have a target, OP to IP conversion. Suppose somebody is achieving the IP conversion, some incentive things can be given. There is a performance push. What the purpose for the performance push? Then based on achievements, KPI driven variable, a short-term motivation. Incentives are not a long-term motivation, it's a short-term motivation. Okay. Second thing, we will talk about a bonus. What is the difference between incentive and bonus? So bonus is also a additional reward paid over salary. The bonus is a statutory, it's a statutory thing. A reward, contribution, a profit, loyalty for a festival occasion. Bonus, why we are creating a bonus provisions? Because organizations has achieved something, they want to share something to the employees on a statutory background. Okay, it's a festival mode in a yearly that can be given. It's a purely based on company performance and also in employee contribution. It's a usually it is also a variable. It's a boost morale, retention, and employee satisfaction. The bonus, what we can call a Diwali bonus, annual performance bonus. These are all some sort of recognition and retention. Then this is about entire, it depends upon the company policy. So now I have taught you two things. What is incentive and what is the bonus? So now, third thing what we are going to talk about today is another word is commonly used as a commission. So what is commission? A payment based on percentage of sale or business generated. Here, it is not a target. Suppose if you are selling one glass or if you are selling one item, yes, we will pay you X amount. That is a commission. If you do this, it's mostly this used for selling purposes. So not for any target oriented thing. If you sell this, yes, we will give you this much of money. This is only for driving revenue or sales conversion. Normally, this commission is used for high volume sales related activities in the organization. Suppose if you have a high volume a product that has to be sold, yes, then commission has to be given. Okay, this is what that we can give. If we suppose if we sell this much, a smaller a contribution that can be given. So these are only sales related the commission. Examples of commission, okay, doctor referral commissions, so insurance sales commission. These are all some of the revenue generation part that we can give commission. Another important thing is called allowances. So what is allowances? Allowances is given to meet out some specific expenses or conditions. There are certain conditions or there are certain specific expenses to support the employee work-related expenses. Some allowances are given. For example, I can tell you, a travel allowance can be given, a food allowance that can be given, a shift allowance that can be given, a night shift allowance that can be given. Sometimes a risk allowance, people who are working in the operation theater, some risk allowance that can be given, or sometimes allowance for attendance allowance. People are coming on time. People are regularly. People are coming to the hospital. This is fixed. This when we are talking about allowances is fixed on pro rata basis that can be given. This is not a mandatory thing. Allowance is an operational convenience for the benefit of doing a routine work, making people to feel comfortable. These allowances are created. Okay. So now, in addition to the salary, four things that can be given: incentives, bonus, commissions, allowances. These four things that we can give. This is purely based on what kind of situations and what kind of background that can be given. That all we can decide. Okay. So I can give some examples of whatever that we are talking about. What is incentive, what is bonus, what is commission, what is an allowances. Suppose if you have a marketing person, a marketing executive or a camp coordinator, this kind of people, incentive, the IP admission target invoiced. Suppose a target is given per 1 month, this much of surgery has to happen. Okay, when those kind of situations, yes, incentive has to be paid. That is called incentive. What is a bonus? Annual performance bonus, productivity linked to bonus. For organizations achieves organizational target, the bonus can be given. Okay. Well, is there any commission? Is there referral conversion commissions? Okay, that's normally it will not applicable, but wherever small things, so if you are thinking of that, we can also give a commission. Any conversion that is happening, OP to IP conversion or camp conversions are happening. We are going for a public camp, then to have 75 people have came for that camp. Then we have identified 10 patients, we have potential patients for surgery. If the camp person is converting all these people for surgery, yes, something that can be given. Okay. Then allowances, when you are talking about, it's a travel allowance. He is traveling or food allowance, travel allowance that can be given. The front office, the front office are the front office is another important thing today. Many organizations are doing it. It's a patient feedback incentive. Google review. If anybody is collecting a Google review, a 10 rupees will be given. Anybody is giving comments, 50 rupees will be given. These are all small incentives. No, that is called incentive. Then people will now GMP will be increased. People will go and collect the feedback form. A Google form if they are filling, or somebody is writing a nurse name or a technician's name and giving a proper comments. With the comments, some additional things will be given. Somebody is collecting a testimonials from the patients, some additional incentive will be given. So these are all some of the things. Front office. Sometimes a shift allowance. I don't know whether the shift allowance will applicable for our type of hospitals. Normally, people who are working in the night shift, a night shift allowance will be given. This is for front office. Then insurance coordinators. That is another incentive. Insurance coordinators, there are two things, the receivables. So what is the pending things? Within 48 hours, whether all the bills are, no, they are dispatching all the bills. TAT achievement incentive. How many days? If it is the credit period is 30 days, within the 30 days, accounts people are able to collect whatever the dues are available. So this is called insurance coordinators. Some incentives are given. Even sometimes, commissions will also be given. Lot of outstanding is there. More than 40 lakh rupee or 50,000 rupees or to 5 lakh outstandings are there. Nobody is making an attempt. Suppose somebody is going and making an attempt. If they collect all the outstanding of 4 lakhs or 5 lakhs, some commissions that can be given. So these are all the things. Even some mobile allowances kind of things, that is an allowances part. That is for insurance coordinator. Even for nurses in a hospital sector, even a nurses can be given an incentive. The quality care incentive. Suppose a nurse, if they are able to control infection rate at this level, some incentive that can be, we can give some incentive. Lot of parameters we can fix, and then incentives can be given. Even today, many people are using a retention bonus for nurses because nurse attritions are very high. In order to retain nurses, yeah, retention bonus is given. Retention bonus is another concept. It's introduced for almost all the people, especially for the nurses. Many hospitals are started introducing the retention bonus. Even for duty doctors, they get keeping a doctor in a hospital is the biggest challenge. Even in 2012 itself, for 2010, 11, even for DMOs, we used to give this retention bonus. Even for consultants, we introduced a retention bonus. If the consultant is with the organization for more than a year, then X amount will be given to them. This is called retention bonus. So nurses will not get any commissions. Then night shift allowances for nurses. Even sometimes a washing allowance that can be given. Then what kind of doctors? Yeah, the procedural incentives. Suppose if the doctor does the procedure, then some incentives that can be given. A profit share bonus. These are all the few things. The revenue commission. These are all various, for your understanding, I'm sharing all this information. Okay. There are also lot of non-financial rewards for high hospital, not only for high hospital, any hospitals. This is not involving your money. Anytime, money people will forget. Money people will forget. Money, suppose if they are giving, yes, apart from money also, a non-financial rewards that has to be given. Non-financial rewards, first of all, employee recognition. Employee is not recognized in publicly. then employee, whatever incentive, whatever money is the employee is getting, he will, yeah, I did it, the company has given to me. I achieved my target, company has paid me. That will not give them any pride. Okay, of course, the monetary benefit will happen. But when pride will happen, when the non-financial rewards, that's an employee recognition, public appreciation for good work, putting the employee name in the notice board, or something, calling all the people in front of everybody is appreciating. So this everybody can be given this a public appreciation for good work. It's it improves morale and motivation. People will also think, yes, I worked for this organization. I did extra work. I did these are all the things company has recognized me. Apart from salary, apart from the things, the employee recognition is also another important thing. Best patient care staff award during the monthly meeting. So normally, day before yesterday we celebrated Nurses Day. Lot of hospitals have created a small recognition certificates. Best patient care certificate, Nightingale awards. These are all small things people started introducing that the employee recognition that will talk about big impact that will create in the organization, because it's only a certificate, maximum a medal or with a certificate, not a monetary kind of thing that will give a big impact for an employee. Then certificate of appreciation. Suppose this is another important thing. When we print a certificates and give it to the an employee, a formal acknowledgement of contributions, then that gives a bigger impact. The employee will see, yes, I got the certificate from my CEO, or I got the certificate from my owner, a coffee with the owner, the who has performed well. Not even a month, something has happened immediately. Somebody has done a good work, then immediately the certificate of appreciation that can be given. Okay, that is called pride, and employee will be engaged. So that is one thing. That is a certificate of appreciation. Then normally many hospitals are doing employee of the month. So recognition for outstanding performance. So that is also one thing. For all the people that we can give, encourage healthy competition, displaying photos on the notice board. This is also another a non-financial rewards. Then these are all some of the things many companies are doing it. Many companies are doing it. Many hospitals are doing it. Employee of the month, certificate of appreciation, employee recognition, good work, patting on the back. A lot of things are happening. Then, apart from that, these are the basic needs. Apart from that, then career growth opportunity. That is another the best recognition that what we can give to the employee. One is opportunity for promotion or role expansion. Suppose the person is a technician, we can give him a senior technician, or his role can be expanded to certain level. So this he will perform highly. He will retain, we can retain the talented employees. So, okay, that is one thing. Career growth is another important thing. Training and skill development. Suppose this is also another a non-financial reward. Okay, yeah, you can sponsor an employee for going for higher studies or higher skill enhancement thing. Small things, a 1 week program or 5 days program or a 3 day program, a special certification program. So wherever it is happening, suppose if you're sending those kind of people, this is a non-financial reward. Then sending a people for a conference and workshops, then the employee will be very happy. Yes, management has recognized me and he is sending me from to some other hospital or some other venue for attending a workshop or attending a seminar. That will give lot of pride, and even the family also. The person will go and talk to the family members. Yes, management has recognized me. I'm going to the conference tomorrow. The conference can happen at any other place. So these are all some of the non-financial monetary, non-financial activities for the things. And even a lot of other things also, a leadership exposure. You take up a small project, employee and recognize an employee, take up that project. Then appreciation from the patients. So many hospitals I have seen, they are taking note from the patients, a video testimony, people are taking it and sending it to the social media. The employees are very happy. So that kind of thing. Then team celebrations, wherever opportunities are that the team is achieving, a particular department is achieving their targets. Yes, team celebration, a team lunch, a team tea, a team, a picnic. Those kind of things are also happening. These are all non-financial rewards. So likewise, a lot of things that what I have given here, a small things what I have given. These are all the things many hospitals are practicing. Why? Because hospitals are practicing human being. They want some sort of recognition. End of the day, what I am going to get today, a small cake cutting will also give a bigger impact. On birthday time, sending a WhatsApp message to the all the employees, that will also give a big impact. Then the lot of things are happening. Special days are coming. A pharmacist day. So calling all the pharmacists, cutting a cake, that is also recognition. Then radiology day. Likewise, whatever days are coming, we need to celebrate all kind of things. That will also give an important things. So what are the key benefits for non-financial rewards? So it improves employee retention, reduce attritions, because people will talk about, yes, yearly sports is people are conducting a sports, or a family meet, people are organizing it. There are 10 people, 10 employees are can be there, but 10 employee family comes on night, they give you food, then people will recognize, yes, my organization is recognizing me and my family. It improves employee retention. Then enhance patient experience also. The staff become a more, they started give more care to their patients. This is also thing. Then build a positive culture. No gossiping. If nothing is happening in the organization, lot of gossiping will happen. What these people are doing it? Why I'm doing this? Nobody is recognizing me. Always people are shouting at me. All negative vibes will be in the organization. If you give more number of non-monetary benefits, then people will, the positive culture will happen. The burnout will reduce, we can burn out. Encourage ownership. I will take the responsibility of doing something. That also improve the service quality and strengthen the employer branding. That is today is the most important thing. The good place to work, which is a good place to work, where I'm recognized. When employee feels I'm recognized, many times employer will tell I'm taking care of my people in a good, still attritions are happening. So good hospitals are losing good people. Why? That is the question. Good hospitals are losing good people because the incentivize is not happening. When I'm talking about the incentive here, not only monetary thing, even a personal recognition is also not happening. That's what a good hospitals are losing good employees. Okay. Then here a few things, few examples quickly I will go through, and I will, I will not take much time here. One is
Actually,
overall hospital.
hello, sir. If you can finish it because the other speaker also is here.
Yes,
Maybe you
yes,
can
yes.
rush it up a little bit. Thank you, sir. Thank you.
Yes,
Thank you.
yes.
Thank you,
Yeah,
sir.
yeah. These are all already I have told many things. Then only few things only then I'm going to give. Suppose if you want to how to design incentive plan, we need to define a goal. We have to identify your owners. We have to choose performance indicators, set target, then calibrate. Then this is what that we can do. Then another important thing, whenever we are doing an incentive plan, do it on pilot basis. Run a 3 months pilot, then communicate clearly. So what are the inclusion clauses? What are the exclusion clauses? We fix inclusion and exclusion clauses, and we'll start the pilot project. Once everybody is aligning with that incentive scheme, then automatically then the incentive can be given to all the employees. Okay, these are all some of the benchmark that I'm not going to talk about all the things. Okay, the most of the things what I have things are what I have covered. Only one thing for incentive, the tracking mechanism that we need to see. What is the target is given, how performances are happening on weekly basis or monthly basis, how we are tracking, what kind of system that we are having to track all the data. Based on that, incentive has to be. Otherwise, people will lose confidence on the incentive schemes. If we have proper data, we are maintaining the data, then everybody will be happy with that incentive scheme. Okay. These are all the few things that what I want to have. Uh, the most of the things I have covered. Okay. So thank you very much. If you have anything else to ask, you can ask me. Fine.
Thanks, sir. I think
Thank
it
you.
was a very elaborate presentation and a lot of insights in that. And
Thank you so much, sir, for being with us and giving a wonderful talk. And just to give you an example of the incentive system, I was at Arvind hospitals. Everybody knows that there is no the money wise like what you mentioned. It is not that money alone is going to make an employee to work for you. So I was there for about 20 years. We never thought about the money as our incentive system, but it is the recognition that somebody gets to work more and more. So the recognition of an employee makes it, more confident or proud. That is what makes the employee to stay for a little longer than what we really expect. So the system works in very differently in every place, are a combination of things. But I think the hospital has to adapt to what is best for them in their own way. So as there is a restriction in our timings, we will probably, Sandil, if you want to give some comments,
Sir,
and then we can
two
move
more
on to.
minutes. 2 more minutes. You can go ahead, sir. I'm just getting into my house. Two more
Yeah, yeah,
minutes, and then
please.
I'll
Yeah,
stop.
yeah,
You
no
can go ahead.
problem, no problem. You
Sure.
please continue. So, sir, I think one of the most important points from John Shaker's presentation is, I don't know if people have understood it. One is incentives, the monetary incentives can be gross on the turnover. Let's say if you are fixing a target of 10 lakh rupees for your hospital every month. And if the entire team is exceeding and you are getting a turnover of 12 lakh rupees. So you give a percentage of the 2 lakh rupees divided among all the stuff. That is something which,
Sandil, I have a very curious question to ask.
yeah.
Do we have any data on the incentives based system? Say, for example, a non monetary versus the monetary, especially on the employee retention,
So
which
I think
works better?
there might not be any data, but people like Dr. John Shaker, Mr. John Shaker, sir, has worked in a lot of hospitals. So from experience base, they understand what works. And basically, I think from sir's teaching, it's basically a mix of monetary and non-monetary. People are not only working for, because as you said, Arvind Eye Hospital, the branding also works. People want to be associated with a large brand. The organization already has a huge brand. So even if the salary is not comparable, or even if there are no incentive system, people want to work with like CMC Vellore or Arvind. These are all branded organizations. But when we come to individual private organizations, definitely there should be a combination of monetary and non-monetary. And I think both works equally. If it's only non-monetary, people may not work. If it's only monetary also, it may not work. That is what I have understood from John Checker's experience. So one thing I wanted to finish that point,
Yeah,
basically
please.
give that gross incentive to all the staff. Like say if everybody exceeds the targets by say if the 10 lakhs is your monthly revenue target, if the target is exceeded by 2 lakhs, out of 2 lakhs, take a small percentage, 2 or 3%, split it among all the staffs. So everybody works in unison for the organizational growth. Second incentive is for the person who actually contributes to it. For example, there is a counselor who helps in counseling for surgeries. Give them a small incentive for each surgery she counsels. For example, 200 rupees for regular surgery, 500 rupees for a premium surgery. So let's say even if she is doing 20, 30, 50 patients in a month, apart from a salary of 20,000, 30,000, they also get an additional incentive of 10,000 rupees, which works well. Third is for retail, for example, opticals, pharmacy, from the turnover, if they are getting a small percentage of incentive, it also works well. So basically, you have to
I
give.
have one more very important question in this because the monetary incentives sometimes has a problem in the sense hospital doesn't work only on basis of the counselor, opticals or medicals. There is an entire cycle. Doctor is there, the paramedicals, other the so-called the running staff or whoever is there, refraction staff. There are so many different kind of categories of staffs are there. But when you give the monetary benefit to only one kind of a staff, how does it really work and what kind of issues that one has faced? Okay.
Anyway, from
Because
experience,
it is some people will be like, say for example, a refractionist may be there for say 15 years, but the counselor may have joined just a couple of years ago, and then she may be probably earning more than what the refractionist may be able to earn. So does it not create an issue in the system?
so basically, it's a give or take. So whether we want to take that small risk of the a little bit displeasure among a staff who has been long term or a staff who has been working well, because on the other hand, not giving an incentive to somebody who's actively contributing, somebody who's very much working for the revenue of the organization, also might lead to a displeasure among the person who works well. So it has to be a balance. That is why giving an incentive, for example, if the council refractionist has worked for 15 years, you also can give them a non-monetary benefit, like call them, recognize them, give them some recognition, or give her a promotion as center chief optometrist, whatever she, to make her happy.
All right.
But not giving an incentive to a person who is actually contributing to the revenues might also be a risky situation.
But this is a very tricky situation because there is always positives and there is always
Yeah.
negatives. And if somebody can get away without this monetary system, things are probably a little bit more easier
See,
than the
basically,
non-monetary benefits might be sometimes works better in an organization where it really kind of makes everybody more happier. But I think it all depends upon the individual practice.
basically, the best system which works is kind of giving a overall gross incentive for the organizational growth, which goes to every staff, even a
Correct.
security or even your housekeeping, everybody. And another problem is many hospitals also confuse between bonus and incentives. They say, like, sir, we are already giving bonus. Why should we give? Bonus is a statutory requirement.
Right.
So it is as per the rules you have to give a bonus. Bonus should not be confused with incentives. Giving an incentive is your own prerogative. What in my experience works very well is basically give a decent salary for survival. And well, let's say in Coimbatore, if somebody wants 20, 30,000 is required for a survival of a person, give that as a basic salary. And then give them an incentive of where if they work well, they can even earn additional 20,000 or additional 30,000 based on the effort they are bringing in. That will give a lot of benefit to the organization. I think before Mr. Rajarajan joins in, we can start the topic. Basically, Rajarajan sir, I will also introduce him.
Yes.
So he is he is a healthcare senior professional from the healthcare industry. Basically worked as chief operating officer in many hospitals, right from MGM to MGM hospitals in Chennai, the new hospital which has come up and doing very well, especially during COVID times. He was the chief operating officer at that hospital, and now he is the CEO of Asaram Hospital, which is in Eluru, Andhra Pradesh. He's a group CEO. It's a medical college and multi-specialty hospitals, many centers together, and he is managing the operations of the entire group. And very good expert in various aspects of practice management, especially customer service. So we have used Rajarajan sir expertise in our own practice development programs also. So I think Sarah has also joined, and he is going to talk about customer experience, because what is lacking in, because these days patients are expecting a lot in terms of customer experience. Though healthcare, we don't even call them patient these days. We have to call them as healthcare consumers, and hospitals are more healthcare organizations. If you see, there is a hospital in Bangalore which is called the Super Health Hospital. It's a new hospital which has come up, who are focusing on the Gen Z. Basically, Super Health Hospital doesn't have a reception, and patients don't. There is zero waiting time for the patients. And pricing is also very transparent. They say like, okay, if you pay for 95,000 or something, the entire pregnancy delivery package is covered, whether you get into cesarean, normal delivery, or you get into any complications. Or even I think you can take a package for your entire family, 3,999, where you get multiple treatments, many n number of unlimited consultations, including investigations free. So there is so much of customer experience which is expected by the patients and
Yeah,
the
thank you,
new
sir. I
age.
take over.
Yes, sir. So I already introduced you, sir.
Yeah,
So
yeah, yeah. I know. I understand.
yeah,
Sorry,
Thank you
my
so much,
camera
Mr.
has some problems. I was not able to troubleshoot it.
no
But yeah,
problem, sir. Please.
so as such a pleasure to be part of this particular webinar on with Glaucoma Society of India for the practice management. So what I would like to talk about is a very specific topic on customer experience management and how this would act as a pillar for marketing and growth. So we're not going to take into much of this thing. This is a very detailed presentation. I would leave the presentation with Dr. Satyan. He would be sharing it with you all. But I would like to establish some of the concepts which you could go back and set it up in your hospital, in your practice. Over a period of time, the customer experience has changed. Like earlier in the 80s and 90s, we used to go to a coffee shop to buy the coffee bean, and then we will tell them how much of chicory percentage and all those stuff, and that's how we were able to take coffee. Then came the packaged coffees, instant coffee, brewed coffee. Now it's all about the experience environment. So over a period of time, the winds of change has happened. So the customer experience has changed. So is the hospitals. Today, it's not about only the clinical treatment that which each of you as doctors provide, or the it's also about the kind of service our customers are getting. And when I say customer is not a unitary single person who's coming for treatment or service, but the attendant. Your own employees are also customers, both your professional employees, doctors, and your Form 16 employees in the organization. Over a period of time, there's a lot of disruption in healthcare, and today we talk about a lot of things as hospital without walls. It's a VUCA world, which is vulnerable, uncertain, clarity is not there, ambiguity is there. So this VUCA world, how to overcome? And as Dr. Senthil was explaining, there are now new hospitals. There is one hospital in Bangalore, which is now saying zero wait time. And MS Dhoni has even invested in this hospital per se. So there's a lot of things which are changing. Even Deloitte talks about this as a very important and real disruption, which is going to change the way we function. Already we are seeing home labs. Already we are seeing many of the treatments, ICU at home, various other things. So over a period of time, it's going to change. Now, as hospitals, now as ophthalmology hospitals, we need to understand, as ophthalmology practice, we need to understand why customer experience matters in the world of eye care. So patients choose experiences, not just clinical results, as I said earlier. Online reviews matter a lot nowadays. Everybody goes into Google review, Practo, your Facebook thing, Just Dial, Mouth Shut. Even sometimes employees who want to join, they even look at sites like Glassdoor, Ambition Box, and see the rating of your clinic or hospital, and then take a decision of joining. Emotional context of vision loss and fear is real, and customers have to be counseled, customers have to be handheld in these matters. Attendance matter as decision influences. So earlier it was only the patient who was on focus for 10, 15 years back, but now we actually pamper the attendants even in the multi-specialty hospitals. For example, in some of the hospitals now, every attendant is also asked, would you like, you have a 1+1 consultation offer. Would you like to consult with any other specialty? So now what is customer experience going to do to us is it is going to it is going to take each of these leads and convert it into footfall. First search, call visit, registration and waiting, consultation, diagnostics, counseling and consent, treatment or surgery, the experience, billing and discharge, the follow up, the post discharge engagement. All this is part of the customer experience. And each of the step has to be tailor made, customized, and the customer should feel like a king at each of the steps. So today, when we talk about patient care, clear communication, respect for the time, give them dignity. Don't, there are places where we call them as cases. They are humans, they are fellow humans. So how do we treat them with empathy? How do we give them that reassurance? Dr. Sendil also had mentioned about how we should talk to them. Doctors should talk only about the technical and give them the choice, but the counselors only have to do the money part of discussions and stuff. The transparency. So all these are very important. You all have to go back and check in your facility how each of these checkpoints are cleared. We'll come to the customer experience maturity scorecard also. So today, when we look at customer experience metrics in hospitals, we look at something, a gold standard, which is a net promoter score. Now, net promoter score has a lot of feedback question, but there is only one question that matters. In a scale of 0 to 10, 10 being the highest and 0 being the lowest, what is the likelihood of you recommending our service to anybody in your circle? If the customer says it is a 9 score of 9 or 10, they are called as a promoters. If the customer gives a score between 6, 7, and 8, they are called as a passive. If customer gives a score of 0 to 5 or 0 to 6, they are called as detractors. The wait time perception concept is another important thing. When a patient or the attendant is waiting, even 10 minutes will feel like 1 hour. So how do you engage them while they are waiting? Do you have a fish tank? Do you have a TV? Don't play a news channel. Do you have magazines? Do you have what are the other things that you are there putting in your waiting area to take the mind of the customer? Have you ever sat in the chair of the customer in each of your clinic or hospital? What they see, what they smell, the five senses. I didn't tell you of the five senses. So what is it that the customer and the attendant perceive when they are seated over there? I have gone to hospitals where TV is on one side and the customer sits on the other side. Okay, the flow of the AC is directly on the customer, and they end up, some of them with allergic rhinitis end up with the sinusitis and stuff. The counseling room is another important area. It's a make or break area of winning the customer. What kind of counseling room you have? Do you have an audio video recording? Do you tell the customer that you are under video surveillance and audio surveillance? It's all been recorded. And at the end of the counseling, as earlier they said, do you have something printed for them to see as a tariff? Do you give them the estimate form? And something which we have implemented in many of the hospitals, which has led to phenomenal goodwill for the hospital, is something called as a cost guarantee certificate. We tell that this particular surgery is going to, say, a cataract surgery is going to be charged 50,000 in the suite room of this hospital, and end of the surgery, even if it has crossed the mark, we close it at 50,000. It's called as a cost guarantee certificate. In some cases, if the amount has come lesser, we refund and say that though we gave you a cost guarantee certificate, the amount used is lesser. Look at the goodwill that it would be generated. Complaint closure time, something which is very important in every hospital. We all, most of the hospital, most of the clinics now collect feedback, get all the complaints, but we don't close the loop. what is the time we take to complain, to close a complaint, to address a complaint, or to even apologize first. Apologize to the customer. By apologizing to the customer, you're winning 10 other customers. By accepting that there is a mistake is when you will start fixing it. So that is another important thing. And the feedback loop, a patient could have complained, an attendant could have complained, and they could have left. But even after 1 week after you settling that problem, if you call and update them saying that we thank you for your suggestion, because of this, many other customers of ours will get benefited. So we have addressed it and fixed it this way. So next time when you come, we hope your experiences would be even better. So these are some of the things that which could be incorporated into each of our facility. So there is a concept of design thinking which will elevate the way how customer experience can be done. For want of time, I'm not going to go into the details of it. And there is a lot of innovation. So customer experience is going to have a leveraging facility with the type of innovation. It could be a profit model innovation, network model, structure model, process model. All these comes under the configuration. Then the offering, which is the product performance, the product system. Then the experience of it, which is the service, channel, brand, and customer engagement. And then there is a 11th type of innovation, which is very unique to India, which is a Jugaad system. So since I'm skipping the design thinking part of it, which would help you, definitely I'll share the slides as I said earlier. So how many of you, I don't know whether you've seen the series called New Amsterdam on Netflix. So there is this Dr. Max Goodwin, who comes into as a medical head of a large hospital, fires the star performers. They don't, it's very clear, I don't want star doctors. I want a team which is full of stars. The team should be a star team, not a particular individual. And he also introduces a concept of how may we help you? How may I help you? How may we reduce perceived wait time? So this HMW concept would, if you start thinking in those aspects, many of your customer related challenges, problems will get an automatic fix. So it's all about breaking the rules and healing the system. Are we ready to change our perspective and do that? Now, customer experience has a very important linkage to the business outcomes. It can bring in increased patient retention. It can bring in more referrals. It can increase your better online reviews in a matter of way which will increase your brand reputation. Customer experience and sharing that with your internal teams will also increase your staff morale. This is also a way of incentivization, a real appreciation for your staff for the work that they have done in a non-monetary way, in addition to whatever John Shaker sir had mentioned. So, but when many hospitals, many clinics, especially eye hospitals and clinics, the challenge is there are a lot of pitfalls. Do you start treating a patient without the diagnosis? We don't. Science. We are all people of science. So we don't. But similarly, when it comes to customer experience, what we really need to do is we need to diagnose the problem. We need to understand the root cause analysis. And in many of the hospitals, customer experience problems are discussed in the boardroom level, but the problem has happened at the grassroots level. Many a times the solutions are there from our grassroots level staff members. So we ignore staff voices. We don't measure. Sometimes we need to be objective. Edward Deming earlier in his life had said one important thing: what cannot be measured cannot be changed, cannot be managed. Later in his life, not everything can be measured. That's where in empathy, that's where in design thinking, a lot of things take this thing. And Edward Deming is considered to be one of the fathers of quality care and stuff. And many hospitals, even John Saker sir was mentioning about it, the pilot testing process. Very important. Don't take one giant leap for mankind. Start with, small steps. Pilot testing is very, very important. So you can. So many hospitals, I would recommend using a patient journey chart. This is a patient journey chart of a patient coming into emergency and going. What happens through to them in various times of the phases of the visit, and what are the opportunity, what are the feelings, what are the thoughts, what are the process, what are the opportunities for the organization to set it right. Okay, so it's a patient journey management. This is a little complicated. This is complete for you to understand what is the patient journey management. But some of your patient journey management could be very simple, very easy in your hospitals or clinics. But this is something which you can have your teams come up with. Understand the pain point at each level. Understand the opportunities with which you can transform that. Okay, so this is a very important slide. Now, many hospitals which I have come across, especially ophthalmology practices, after working sometime with Dr. Sendil for Oftal, many hospitals are at level 1 and level 2 phases. So there is a ad hoc but individual empathy. Some of the staff act with empathy, doctors act with empathy, but it is not across the spectrum. It's process led and SOP driven. It's not bad, but the thing is, the process is very management centric or very revenue centric, not customer centric. The third level of maturity is when the experience design, the journey ownership, the journey management come in. The fourth level is where the data led frames and prompts, that is the patient reported experience measure, patient reported outcome measure. So we have a lot of patient reported experiences, non-clinical aspects. Patient reported outcome measures is the clinical aspect. So a patient after cataract, at what day he or she is going to be able to read, and what level is the reading speed, the reading understanding, the cohesion, the coherence. So there are various scales in hostel cycle which can be adopted. So frames and prompts are pillars of customer experience, data led, and it can also, another thing is the NPS, which we discussed about. The fifth level, which is where I want you all to go to, is a strategic customer experience, where the customer experience, based on all the things that you have implemented, is linked to the revenue and growth. Okay, so many hospitals are level 2 or 3. You focus on NABH, not bad. You will get to level 2 or level 3 in some cases. But above that, you really need to put in efforts. Low experience governance. You're not looking at the frames. You're not taking the experience aspect, identifying opportunities and converting. So you need to fast track to level 4, and over a period of practice, 6 months, 1 year, you will automatically get into the level 5 phases. So we have discussed about NPS. How likely are you to recommend a eye hospital to others? So the formula is percentage of promoters minus a percentage of detractors will give you any score about 72 is a very good score in NPS. I have been able to scale hospitals. It was a new hospital. So we had scaled those hospitals from a score of 80 to 95. We are already at distinction, but we made it near perfect score. So this is a very important concept. I would want you, one important thing that you could go back and start is NPS at your facilities, frames and prompts at your facility, customer experience maturity level at your facility. So waiting time explanation clarity, counseling understanding, staff empathy, billing transparency, these are all some of the things which you can start measuring objectively, not subjectively. Prompts is eye care problem, improvement in vision, post-op comfort, ability to resume daily activities. So there is an important concept for brand reputation, for integrating NPS, frames, prompts, and your Google review score. And all this is very important because there is another important concept. I'm sure Dr. Sendil would organize definitely one more thing for the Glaucoma Society of India, which is Google My Business. If you have not had a session on Google My Business, I will say that it is one of the most important thing for us. So Google My Business, how to set up your Google GMB, how to manage, how to keep updating, how to leverage and get patients out of it. It's a very important tool other than your social media management as well. So, so marketing is another aspect. I will quickly just this thing. Customer experience, when you set it, marketing will automatically flow into the right ways. So you don't have to. Your customers would become your marketing this thing for practice growth. So there are some 4 or 5 important concepts: awareness, trust, access, conversion, and patient experience. Okay, how do you make awareness? How do people know that your facility is there? You are a specialist in glaucoma, or you are a specialist in cataract, or you are a specialist in retina transplantation, any of the high level eye surgeries. How do they know? How do they know that you're a specialist in oncoretinoblastoma? Okay, so how do they know? How do you create this awareness? That's a very important question. What is the trust that they will have on you? How do you address those trust related issues? How is your other patients rating you in Google? What is the way to access your hospital? How do they come? Do you have parking? Which is the peak time? Which is the non-peak time? When do they have to fix an appointment? Do you have a digital front door where they can fix an appointment? So all this, you can set this all with Google My Business again. Then comes the conversion. They've come as a footfall into your hospital. You can even lose the patient when they come and asking your security for where to park. Your security on a Monday morning at 11 a.m. in the hot sun would be very irritated, carrying a bulk of problems from his home also, and could rudely answer to them. The patient will not park the vehicle, will turn and go to the next hospital or go back home. Okay, so the conversion at every touch point in your hospital, whether they have digitally spoken to your telecom people, do you have a customer connect centers in your hospital? When they came, did they park in the right place? Have you informed them about your availability of parking and stuff? Then, how did they do the registration? How quick? Where they were they waiting in the queue? I'm sure. I think I joined right around that time when Senil sir was talking about the queue management system, which is a very important tool in hospitals, in every clinic and stuff. And eventually the patient experience. Okay, failure in anyone reduces overall growth. High skill, you could be really skilled, but if there is no awareness around of people about you, about your service, about your reputation, about your outcomes, about the kind of experience patient would have when they come to your facility, you will still end up having low volumes. So as I said, the macro environment, the planning of marketing, the micro environment, everything is definitely related to the customer experience. And especially, for example, the way things have turned out in the Tamil Nadu election, the Gen Z coming forward to vote and creating a major upset, though it was predictable, 60, 70 years of a particular type of government, want for change, and the Gen Z coming forward noting. So, what is your patient demographics? What kind of patient demographics you're having? What is your attendant demographics? How are you addressing to all of them? What is the economic factors? Are they coming from high society? Are they coming from low and middle income group? This thing, for each you have to define your waiting area in a different way. In a high society, this thing, say you are at the the most posh locality of your city, you know, those people look like minimalism. They would like channel music. They would like, diffusers and fragrance in the air when they're waiting over there. They would like an outlook or a Time magazine, not local vernacular magazines. So how do you act? How do you define your this thing? And again, one such thing which I have seen in many of the doctors generally, I'm not pinpointing. We will go to all the conferences. My wife keeps asking me, "What are you going to do with all these plaques and shields and this thing that they give you?" And we keep storing it. And in our clinics and hospital, in our consultation room, we will put it in one this thing, and when we look at it, it will not even be dusted. Dust would have settled. There would be cobwebs also. Sometimes there are lizards at the background, and our patients see that. We might not see that. So when you go back to your clinic or a consultation room next time, see whether that has been cleaned. Highlight and showcase what you want to showcase. Do not show everything. Do not play out all your cards. It's a game of rummy. So play to your power, play to your strengths. So Moosefield High Hospital, their global reputation, their specialist positioning, the strong referral network, the research leadership, all these help them. This is one of the best high hospital as per various studies. So we have seen another important aspect is the consumer behavior in ophthalmology. For for doing your customer experience, you need to understand about consumer behavior, what the trust level, the recommendation, the reputation, accessibility, the perceived expertise that they have on your clinical acumen. The price, okay, price, as earlier speakers mentioned, it is secondary to trust in most surgical cases. There are people who go to premium hospitals and pay much higher than other hospitals. It's not because they don't want to get it cheap, because they trust in a better brand. So trust is a very important thing. It increases with brand reputation, accessibility, review. That's why many hospitals, if you look at, they do what is known as a cluster bombing nowadays. They will not set up one small hospital or one big hospital. They will set up 3 or 4 big hospitals in the same city. They will set up 4 or 5 small clinics and this thing in the same city. You would see this in dental more so than ophthalmology, in my expertise. Ophthalmology, some of the big brands do multiple setups in the same city. So market segmentation is very important to manage your customer experience. Positioning. Where do you position yourself? How do you position? What is the strategic clock that you're servicing? These are all some of the concepts. You can look at it, and your BCG matrix, various things. It all takes we can do a PhD on this for ophthalmology for each of your hospitals. So how do you consistently rank number one? Bascom Palmer Eye Institute case study is a classic example of it. Their positioning of the super specialty excellence and attracting global reference. Okay. Product. Okay. So one of the things is, we are in a service industry. We convert each of the service line items into a product. Cataract is a product. Glaucoma is a product. Various other procedures and this thing is a product. Product marketing is easier. It gives a clear vision. It's the safety, trust, outcome, experience. How do you say all this? Now, if we are still stuck in the service marketing aspect, you will only see the blurry image in my screen. If you want clarity, if you want to have a better product marketing, a better customer experience management, you need to start getting into the product marketing concepts. Okay, pricing. People always say price. If you increase the price, people won't come. Okay, that's never the thing. Pricing influences perception. If you keep a little higher price, people come because they will know that only dress circle comes there. Why do clubs charge a hefty this thing? Why do some of the international schools charge a hefty fee? because they automatically classify their customers. They don't want everybody to access it. Okay, higher price often signals higher quality. Pricing defines position. Even your matrimony, Bharat matrimony or any other matrimony, now they have elite matrimony. When you pay 6,000 and 10,000 and 15,000 in Bharat matrimony, you pay 1 lakh, 2 lakh and 5 lakh in elite matrimony. So as you pay, as you so social you get. But one important concept I want to say is the willingness to pay, very strongly related to customer experience. The thing is, it is not that if you have cheap, many people would come. Willingness to pay increases with trust, reputation, technology, perception, and experience, and just not cost alone. Still, people are buying iPhones when other phones are available. Still, people are buying Samsung. Still, people are buying Huawei. So, all these brands, why still people are buying Mercedes, BMWs, when you have your Marutis and other cheaper cars in the market. So, willingness to pay, people are ready to go to Starbucks and drink a coffee which is not all that great sometimes from an Indian context, especially as a South Indian, our filter coffee is much better. Even Starbucks had to introduce a filter coffee range for them to be successful in India. Okay, so Optical Express again, they charge premium price, brand trust, technology positioning, market. Customer experience can be managed to each of these concepts. That's what I'm trying to say. Tariffing strategy. Okay, pricing is one thing, tariffing is another thing. You need to know ABC, activity based costing. Many hospitals don't know what is the cost of a service to their own this thing. So there are a lot of cost accountants in the market who will do it. We'll be happy to do that via Offtal as a service to all of you. As a product, we'll offer that. Target segment, competition, value percent. Many hospitals do something called as a market plus market minus. Okay, that is if that hospital is charging 40,000 for cataract, I will do 38,000, 35,000. So what happens is, though they are doing 40,000, their cost of operations would be 20,000 only, which they would have achieved with something, a concept called learning curves. Over experience, over time, they would have optimized it to such levels that they will spend only 20,000 and get 40,000. But what you're doing as a competitor starting in the same area or nearby, you're doing a market minus strategy at 38,000, but still your cost prices would be 35,000 because you have not had that learning curve. So it's all very, very important to understand pricing, costing, tariffing aspects.
Sir,
So,
Rajarajan, sir, if you
yeah,
can.
for want of time, I'm just moving
Yeah, we can.
ahead. Yeah, so conversion funnel. You know why patient experience is very important is if you start giving a higher level of patient experience, then your conversion funnel will not be a triangle, it will start widening out at the base also. So the number of patients coming in as footfalls would be increased. Number of patients which you retain will increase. So how do you create awareness, interest, consideration over other eye hospitals or eye clinics? How do they come and opt in for the surgery? One of the things which works in ophthalmology is a second opinion consultation. Many people do window shopping. They go to a doctor, and mostly what we see is the second doctor they go, they have a better strike rate in converting and having them operated at their clinic or facility. And the retention, the word of mouth, and more patients come into your this thing. So there are a lot of things. What I would like to say at the end of this is that, you know, customer experience is a real thing. It is not perceived. You know, patients, attendants, our own employees, our own doctors in our facility, other than the owners, they're all customers. How do you address? There are, even your vendors are your customers. Your vendors are the best marketing people. If you give them, if you treat them with dignity, you give them the payment on time or in advance, they will bring 10 other customers. Do you have the thing of having a marketing channel, in WhatsApp or or a broadcasting thing in WhatsApp and sending all your case stories and all those better patient stories and all those stuff to your own vendors. There is a theory called six market theory. So if you are fixing these six markets for you, it will work for you. I will share it with our Dr. Satyan, and he will in turn share it with you all. So at the end, I would like to say never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Margaret Mead was a wonderful anthropologist, and this is what she had to say. And there are a lot of things, books like what Kamala Hassan used to do in Big Boss as an inspiration. I have taken it up, and I would like to leave with for design thinking, you can look at Growth Field book. Hardwiring Excellence by Quinn Studer is a wonderful book. It talks about purpose, worthwhile work, and making a difference. And also another book by Marshall Goldsmith, got What Got You Here Won't Get You There. You would have your degrees, you would have your expertise, but if you don't manage the customer experience, which is one strong pillar in the 21st century, we will lose it all. And then finally, Fred Lee. Fred Lee ran Disneyland for 20 years as a CEO. And then he joined one of the largest healthcare corporations of US as a CEO of their hospital group. And he wrote this book, If Disney Ran Your Hospital, 9.5 things that they will do differently. Focused entirely on customer centricity and understanding the pulse of the customer. You might be still the doctors who will hold the hands of the customer and look at the pulse, or directly put the slit camera and look into the eyes of the customer, give a pat on the back of the customer, give a smile to the customer and acknowledge them when they come and go and pull the chair and whatnot, chivalry, courteousness, and all those stuff. But all these are being counted, and this is a sum total of customer experience that you can give. Thank you very much for having me over here. Thank you.
Such a wonderful talk, Mr. Rajraj. Thank you so much for all the presentations were excellent, and I know that the practice management is not that easy. Like just listening is not enough. Once we put everything into the perspectives of for the practice management, that will be really awesome. And I'm sure that some of us may be just calling you to ask for your help to assist us. And I think Sendil, just you want to say something?
No, sir, I think thanks to all the speakers, especially Mr. Rajarajan, sir, was just traveling and he got back. And
Absolutely, yeah.
John Shaker, sir, also he's basically got so much of experience. He wants to now spread the knowledge. And I thought, let us take his knowledge to the ophthalmologist. And thank you all. I think we are already a little late. And thank you for the opportunity, sir.
Thank you so much, because this is a very different session from Glaucoma Society of India that we have organized. We always have the case presentations, journal clubs, and only the clinical knowledge sharing. So this is a little completely different. There were many requests on this particular session, so that is why we have just incorporated. I'm sure that some of us at least would have got some benefit out of these presentations. If any of you want to contact them, you are most welcome to do so. They'll be more than happy to assist us. So thank you so much, and good night.
Thank you, sir. Thank you. Good night.
Bye bye.
Thank you all.
Thank you all. Thanks.